Richin Koshy, a senior PG from Bardhaman Hospital, Netherlands. So I'm standing before you to present my presentation, knockout gas, a case report. So before I present with the case report, a brief introduction on knockout gas. So hydrogen sulfide is an environmentally toxic, produces from natural and industries. Natural sources include volcanoes, hot springs, underwater thermal vents. It is also a product of anaerobic decomposition of organic acid plant matter. Environmentally produced H2S pose a major risk to workers in industries where gas is ubiquitous and it cause hazards worldwide. Toxic occurrences depend on the concentration of H2S to which individuals are exposed. Acute H2S exposure may target vital organs including cardiovascular, respiratory and central nervous system. The most important symptom experienced by the victims of acute H2S exposure is loss of consciousness on lockdown, which directly impacts the victim's ability to exit the contaminated exposure site. The mechanism of action: so a single high dose exposure, the most common acute form, will lead to an increase in anaerobic respiration, inhibition of cytochrome C oxidase, lactic acidosis, and cell death. This is the hallmark of acute H2S toxicity. The common signs of CNS, loss of consciousness, seizures, case report. So this is a case of a 30-year-old male who works at the local Jal Board in Delhi. On the morning of 22nd November, while flushing his clutch from the inner wall of flush treatment tank, as per his co-workers, he immediately perceived a harsh pungent odor, following which he felt dizzy and fainted. He was taken to a local hospital. The primary management was given. He was referred to Sufficient Hospital for further treatment, where he presented complaints of blurred vision, dyspnea, and confusion. On physical examination, the following findings are: his pulse rate was 84%, his blood pressure was 45/90, SpO2 88, and showed clinical manifestations of H2S poisoning on system examination. He was quickly shifted to the ICU, where he was intubated and put on a mechanical ventilator and was managed symptomatically. So the toxicity of H2S per concentration. So as you see over here, the lethal concentration of 50% of humans with 5 minutes exposure is 800 parts per micron. So on exposure to 800 parts per micron, the following clinical manifestations of H2S poisoning occur. So in our hospital, the mainstay of treatment was symptomatic and supportive care. The early administration of hyperbaric oxygen and amyl nitrite and sodium nitrite may be beneficial. Amyl nitrite has high affinity to H2S, which results in a competitive binding, producing such methemoglobin. The patient was managed in a hospital with symptomatic and supportive care. He was managed in the hospital with steroids, nebulizer with glutathioneine, and infection control with antibiotics. He was discharged on 9 days of treatment. But the treatment basically over here is, when you see a patient with H2S gas exposure, the first thing what you have to do is you have to, as a first responder, you have to give him respiratory protection and you have to decontaminate the person. And the most important thing is that antidote is amyl nitrite and hyperbaric oxygen can be beneficial over here. And along with that, symptomatic supportive care for CNS, CPS, and RS.
What was your role in this?
Ma'am, we are actually having a toxicology unit in Chapel Hospital where we see poisoning patients and we give our opinion.
So what was your opinion?
Ma'am, over here we have to give an antidote, amyl nitrite, sodium nitrite, and along with that, hyperbaric oxygen can be beneficial in these patients. So our opinion is the antidote part of it.
Okay, was this case sent for autopsy?
No, ma'am, he survived. He survived. He was managed in my because
बड़ा फोन से देना चाहिए कि नहीं हिंदी तरीका हाँ ये बिग साइज ना इट्स नॉट विजिबल नाउ आई एम सेइंग दिस इज ऑन एंगल प्रोफाइल ठीक है किसी को कुछ पूछना है डाउट तो पूछ सकते हैं एक दो क्वेश्चन